Geto Shimura. Okay, so we need so thank you today for joining the Zoom today, the webinar about Fujita Medical Innovation Center, Tokyo, Fujita Haneda Clinic. So now I will introduce the speaker. He is the director, professor, and chairman from the Fujita Health University Department of Clinical Regenerative Medicine, Dr. Professor Shigeto Shimura. Dr. Shigeto Shimura is a board member of the Japan Regenerative Medicine Society, a board member of the Japan Cornea Society, a former board member of the Cornea Society in the United States, a certified regenerative medicine practitioner, a specialist in ophthalmology certified by the Japan Ophthalmology Society, and a specialist certified by the Japan Anti-Aging Society. Wow, Dr. Shimura knows everything about anti-aging and eye, with a surgical track record exceeding 1,000 corneal transplant surgery. We're going to talk also about the corneal transplant, over 10,000 cataract surgery, and more than 100 surgery for ocular surface reconstruction. He has also taken on numerous challenging cataract surgeries referred from other facilities. He is currently conducting research in regenerative medicine using iPS cells and mesenchymal stem cell. So Dr. Shimura really know about stem cell, yeah, which is like very popular now. He continues to provide optimal solution to patients by leveraging his accumulated experience and cutting-edge medical research. Okay, for Dr. Professor Shimura, please, please present your presentation about medical checkup and also the ocular operation. Thank you so much for your time, Professor Shimura.
Thank you. Thank you for the introduction. Can you hear my voice fine?
Yes, great.
Good. So I'll be talking in English. I am presuming that you understand English. And
Yes.
I understand that you have the slides with you in Indonesian as well. So I have two sets of slides today. My first slide will be on a more general topic on our institution and the medical checkups that we do for our clients overseas, as well as the Japanese. Our location is right next to Haneda Airport, Terminal 3. It's one station from the airport. You can actually walk if you want to stay healthy, but it's really a good place to be if you're coming to Japan through Haneda Airport. We offer advanced medical care from the cradle to the grave, meaning that we do offer therapeutic options for reproductive medicine for people who are trying to have babies. We do cell therapy for these people as well. And we also do offer these medical checkups and the program called Active Longevity. This is like an overview of what to do, what to eat, how to spend your daily life in order to extend your lifespan as long as possible. This is what our clinic looks like inside the reception. We have private rooms for those clients undergoing the general checkup. They stay in the same room every day. And can you mute?
Maaf, bisa tolong di mute nggak? Di mute sama matiin kamera mungkin, teman-teman. Terima kasih.
Yeah, thank
Okay.
you.
Please, Professor.
Yes, thank you. So we have private rooms. We have 12 private rooms for clients undergoing general checkup. They stay in their rooms, and we have staff members that come to them for for each exam that they're undergoing. As you can see, it's very private. There's a lot of privacy. You don't see other clients while you're doing your checkups. So I think that's good for people who are like, for example, famous people. We've had actresses, actors. These people really like our privacy setup. So that's one reason that we recommend our clinic. We have other state-of-the-art machines. The one on the top right here, this is a upright CT scan. There's only about 5 of these devices in the world. They're all in Japan right now, but it's a CT scan that you can scan while you're either standing up or sitting in a chair. And as you can see, the area, it's very open spaced. So people who are very claustrophobic, people who are afraid of being in a very narrow space can also do this without much discomfort. We have as you can see on the left bottom side, we have like a gym. This is for rehabilitation for patients who are trying to recover from surgery or patients who are trying to recover from brain lesions and things like that. So we offer medical services for very young people to very old people. These are some of the devices that we have. I talked about the upright CT, the CT scans that we have. This is a 3 Tesla MRI. It's very powerful. It has very high resolution. We also have this device on the right side. This is a PET scan. We have 2 PET scans. One is a standard PET CT scan, and the one on the right here, this is a PET scan that is customized for doing breast scanning for breast cancer. It's very comfortable. There's no pain involved. As you know, cancer screening for breast cancer can be painful, but with this device, it's not painful at all. And the device can also be used for a brain scan. This is the head scan. This is to detect Alzheimer's disease and other brain disease. Our Active Longevity Research Center, it's like an overall program. We use apps. We have a cooking class. We actually do have a cooking area where we can teach customers how to cook or how to make food that is healthy for them. We offer dietary advice and other devices to monitor glucose and things like that. And so this is not a single program that can be done in a single day, but it does require a few days. But this is something that is, I think, has really a good potential to have people learn how to protect themselves from dying too early. My specialty is regenerative medicine. We have several centers that is working on this. My center, eye center, I will talking about this on the next talk. But we do offer regenerative medicine for reproduction. That's for people who are having difficulty getting pregnant. Musculoskeletal disease center. This is mostly like for the knee joints, hip joints. And we also have an overall rejuvenation center. This is using stem cells to provide more youthful skin. We don't do aggressive plastic surgery that, for example, changes your face. Our regenerative center offers therapy to help people look a few years younger than they are now. For concerning cancer genomic medicine, we do several tests that can detect cancer very early. The cancer genome analysis, this is to screen for cancers that can be transmitted to your offspring. And we also check for genetic backgrounds that may be involved in the risk of cancer. We also offer several different types of biopsy. This is a liquid biopsy from bodily fluids like blood, urine. Can screen for primary cancer as well as relapse of cancer after an initial cancer surgery. We can also, this is a bit special, but we can make 3D organoid cultures of cancer derived from cancer tissue. This is tissue obtained after surgery, and we make 3D cultures to make a mini cancer organoid, and we can check with this organoid, we can check if that patient has sensitivity to certain specific anti-cancer drugs. The reproductive medicine, as I said before, this is to allow young patients or even elderly patients to have children. We have the latest ART treatment, artificial fertilization therapy. This is all done in a day surgery setting. And we use stem cells, mesenchymal stem cells derived from fatty tissue. These cells can be used to rejuvenate the ovaries to allow a more successful impregnation. Rehab, we have several machines that we've developed with other companies. This is, for example, developed with Toyota. It's a device that allows you to sort of rehab, trying to walk, to analyze how you are walking and to give advice as to how you should be walking. And it helps people to get feedback on how to recover from cerebral disease or other knee joint injuries and stuff like that. We have these walking assisting locomotor devices. It's like a semi-robot to help people walk. The eye center, I will be going over this later on with my second talk, but in general, we offer regenerative medicine, cell therapy, stem cell transplantation, as well as your standard corneal transplantation. We also do a lot of cataract surgery as well as ICL surgery for myopia. And we also do vitrectomy. This is surgery for retinal disease, such as epiretinal membranes and macular degeneration. Our muscular disease center, rejuvenation center, again, we do a lot of surgery on the knee joints, and this includes doing actual surgery to the knees as well as injecting PRP. This is platelet-rich plasma derived from the patient's own blood, and we also use adipose-derived mesenchymal stem cells. This is also derived from the patient's fatty tissue. So with the PRP and the mesenchymal stem cells, two surgeries are required. The first surgery will be for the procurement of fatty tissue to culture these cells. And then the second procedure will be for the actual transplantation. There's usually about a 2-month lag, but 2 visits will be necessary for this. And that was a general overview, and we are very closely associated with several institutions. The main one being the Fujita Health University in Aichi Prefecture near Nagoya. It's the largest university hospital in Japan. We're also working with this place called King Skyfront. It's very close to our institution, and Keio University, you may have heard of it. It's one of the bigger private universities. I'm also from Keio, but they have a campus in this area in Kawasaki. We're about 10 minutes apart by car. And they are actively involved in developing new techniques for regenerative cell therapy using mesenchymal stem cells as well as iPS cells. And we're also collaborating with several Japanese companies, as you can see here, to create a new environment to allow the development of new technologies to treat patients that have been very difficult to treat so far. A few slides to show our main hospital in Aichi. This is the Fujita Health University Hospital. It's close to Nagoya, which is located at the heart of Japan. It's in the middle of the country. It's about 2 hours from Tokyo. They do have an airport, and so the airport near Nagoya, the hospital is about a 40-minute drive from the airport. This is the general overview of our hospital institution. As you can see, it's very big. We have a lot of land surrounding the area, so we are still building other buildings for newer techniques. And the Fujita Health University Hospital, we have one of the highest levels of healthcare in Japan. We have the largest number of patients, as well as doing the most number of surgeries in Japan. We have the largest number of beds. This is for inpatient care. And we also do a lot of robotic surgery. This is robotic assisted surgery. For example, the Da Vinci, I'm sure you know of, but we have the most number of devices and also do the most number of surgeries in Japan. And as I showed you before, we have an excellent rehabilitation program for patients after they have finished the surgery. We have several hospital accreditations. Most of them are international, as you can see here, JCI accreditation. We scored a 99.8% score. This is one of the highest levels offered by the JCI accreditation globally. And with this accreditation, we can offer medical services for patients who have insurance, local insurances in their own country. These are some of the surgical robots that we have. This is the Da Vinci robot. And this is the Hinotori surgical robot. This is a Japanese-based device. It's very similar. Both are used to do surgically assisted surgery. We've had all these different devices as well. We have the second Da Vinci unit, and we have the Hugo unit as well. So depending on the type of disease or the patient, we can choose all these different robots to help the surgeon as well as the patient to recover quickly after surgery. These are some of the surgical techniques that we are offering, all the different cancers, prostate cancer, kidney cancer, and we've also started doing robot-assisted surgery for breast cancer as well. I think that we are the only institution that offers robot-assisted surgery for breast cancer in Japan. And this is the International Medical Center in the main hospital in Aichi. The entrance here is dedicated to the International Medical Center. As you can see, the lounge, as well as the private rooms they have, is very similar to the type of rooms that we have. So Haneda works to do the initial screening for inbound patients. And if they have something that requires more intensive care or surgery or inpatient surgery, then we refer these patients to Aichi, to our main hospital for extensive treatment. Again, as you can see, they have beds that offer hospitalization care during their stay. Some of these rooms can offer space for their families to stay as well. So Fujita, as a university, we promise satisfaction with the world's best quality healthcare services, including ourselves and the other hospitals that we have in Aichi. We have a lineup of really specialized surgeons that are real advanced and have the advanced knowledge as to their subspecialties. I myself, I'm an ophthalmologist, but we also have ENT specialists as well as knee specialists. So we can mostly provide any type of service that is required by patients. So that is my first talk, my first set of slides. If you have any questions on this before I move on to my next talk.
Actually, I have many questions, but should I ask now or later, Professor?
You can ask now if it's a general question. Sure, go ahead.
Okay, so I want to ask about the surgical, your robotic surgical, about
Mhm.
the recovery. Usually, how many percent the difference between the robotic surgery and the original, the usual surgery? Like how many percent less for the recovery time, the difference?
So
And yeah, and what is also the advantage of the robotic surgical compared to usual surgical?
So the compared to standard surgery, of course, the robot-assisted surgery can only be done for advanced for initial stages of disease. If it's a big lesion, you still need standardized surgery. But for initial surgery for primary cases, robotic assisted surgery offers a very small wound, like a few centimeters. I don't do it myself. I'm not, it's a different subspecialty, but the surgery can be done from 2 to 3 different wounds that are each about a few centimeters. And this can be done for the lung or other tissues as well. So recovery is very fast. And so even surgery for cancer, patients can be discharged after less than a week. And also the wounds are very small, so the scarring is less as well. So that's a huge advantage. One of the disadvantages of robots, well, it's not a disadvantage, but it can be difficult because the area of surgery is very small. You need to use a camera and things like that. So you need to have surgeons that are really trained for this. But we do have surgeons that are really trained and experienced. So I think that with that, the trained surgeons and the different types of robots we have can offer several options for patients who have early stage cancer.
Okay, usually it's all for cancer, or is there any other disease that this robotic surgery usually is used for?
It's mostly used for cancer, I guess. It can be
Mm,
used for prostate surgery as well, I suppose, but I think the biggest advantage is cancer.
okay, what cancer, Professor Simura, that usually be done with this surgery? Like you said before, it's like maybe can you help to repeat the
Yeah, I'll
cancer?
show you the, wait one sec. Oops, where's my other slide? One sec, I'll find it.
Thank you. Because this is very famous, yeah, because in other country, maybe robotic surgery is not very famous, but in
Mhm.
Fujita, you have a very specialized team for this uh,
Yes,
robotic surgery.
one sec. So can you see the slide? Whoops.
Yes, 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 yes. Oh,
So
prostate, kidney, bladder, gastric, esophageal. Okay. Colorectal, liver, spleen. This is for
pancreas.
cancer, Doc, mostly.
This is mostly for cancer, yes. Head and neck,
Okay.
lung resection, and as I said before, we've also added breast cancer to this.
Yes, yes. But maybe for the stage one, for all of this cancer, stage
Yeah,
one or two?
I can't tell you which specific stage for each different cancer because I'm not a specialist, but in general, it will be for initial disease, yes.
Okay, okay, okay. I
So
also
that's
have a
why
question.
that's why the health screening is important because the initial stages of cancer doesn't have much symptoms, so patients may not even know that they have cancer. So
Yes,
so we do screening for patients or for customers, for clients that do not have symptoms of cancer, but sometimes we do find cancer. And if they're asymptomatic, it's usually early stages of cancers for which we can use the surgery the robot assisted surgery. We really can't help patients who are in the end stages of cancer. I mean, we do get patients asking for help, but the late stages, advanced stages, there's really not much we can do. So this is all about treating patients with early stage cancers, mostly who have been detected using the health screening system.
okay. So I want to also tell everybody about my experience in medical checkup in Fujita, and maybe later Dr. Lia also has done it before. So it's very precise to find tumor and cancer. Maybe I can speak a little bit in Indonesia, Profesor
Sure, go ahead.
Simura. Jadi kita udah melakukan, aku sama Dokter Lia udah melakukan medical check-up ini, Dokter Aryo. Eh, dan mereka benar-benar sangat
Ya,
detail dan profesional untuk menemukan tumor dan cancer atau kelainan-kelainan lain di tubuh kita. Itu detail banget. Nanti mungkin Dr. Lia after presentation Professor Shimura, Dr. Lia also can explain how detailed is it because me and Dr. Lia have been that medical check-up there for 2 days medical check-up, including all the blood test dan apa mesin-mesin MRI, CT scan, PET scan yang tadi udah dikasih tahu Profesor Shimura dan juga eh, kolonoskopi dan endoskopi dan itu benar-benar sangat detail. Kalau di Jepang tuh mereka bedanya sama negara-negara lain, mereka sangat detail untuk menemukan tumor dan kanker sampai yang sekecil-kecilnya pun mereka bisa temukan dan mereka tuh emang sistemnya tuh preventif. Jadi untuk mencegah menjadi late stage, untuk mencegah terjadi sampai ke stadium akhir. Jadi mereka pengennya tuh di stadium awal udah bisa diterapi sehingga prognosis atau jangka waktu hidupnya itu bisa lebih panjang. Karena kalau kita tahu cancer itu kalau udah di stadium yang terakhir itu kan susah Dokter Aryo ya untuk maksudnya untuk hidup lebih lama. Tapi kalau di awal-awal stadium dini itu udah ditemukan itu bisa dilakukan terapi. Salah satunya terapi robot ini di mana em, apa sayatannya juga sedikit gitu. Jadi bisa lebih cepat sembuh, lebih cepat pulang dan kansernya juga bisa lebih cepat diterapi gitu. Dokter ya mungkin ada pertanyaan untuk
dok.
Profesor Shimura sebelum aku tanya lagi.
Iya dok. Jadi ini kan ada beberapa yang join mungkin dari non medis gitu ya. Tadi Dokter Sonia sampaikan bahwa pemeriksaan di Fujita Hospital itu for the details beda dengan yang di Indonesia. Nah, kalau mungkin di Indonesia itu kan lebih banyak screeningnya masih konvensional menggunakan tumor marker, terus paling beberapa imaging tapi yang masih sederhana gitu. Nah, mungkin boleh dok diberikan gambaran ke beberapa teman-teman kita yang join, apa yang membedakan alur detail yang di Indonesia dengan yang ada di Fujita hospital? Apakah dari from screeningnya, kemudian nanti lanjut ke tumor marker, kemudian di compare dengan imaging yang lebih lebih canggih, atau seperti apa dok? Mungkin boleh share ya dok ya.
Iya. Oke, mungkin Bu Makla bisa tolong diterjemahkan kepada Profesor Shimura?
Ah, iya Bu. Ini tadi pertanyaan hampir mirip dengan yang di awal atau
Iya,
ini
iya,
kayak pertanyaan
iya, sama-sama. Tapi maksudnya, iya,
lebih ke
iya benar.
khusus
Jadi
ya,
untuk
lebih alur.
enggak, lebih ke alur untuk menemukan cancer. So, Profesor Shimura, Dr. Aryo asked about what is the difference between the medical checkup in Fujita compared to other countries, including Indonesia and Singapore? Maybe Dr. Shimura also have been going around the world, so you know what is the difference between medical checkup in, because we are in Indonesia, we are near to Singapore and Malaysia, so we usually do checkups because the Indonesia maybe the machine is limited, so sometimes we go to Singapore and Malaysia, and but we want to know what is the difference in Fujita, which is like very high tech, and what is the difference in detail between Fujita and other country to find cancer or tumor.
So device-wise, I mean, we have all the PET scans, PET CTs, and the endoscopy. Our endoscopy devices, they are also AI assisted, so they can help the physician find very small lesions. For example, my own wife underwent the same checkup, and we found a very small tumor in her esophagus. It was about 3 millimeters. This is something that can be not found if it was just a normal endoscopy. This is an AI assisted, so they can help find these different lesions. And once we found this lesion, she did surgery for her esophageal cancer. She was in hospital for like 3 or 4 days. It was endoscopy surgery. So the difference, I think, I would say, is that although we do have the more advanced machines, and I'm sure Singapore and other countries have also similar machines, but we have doctors that are very experienced, number one. And then number two, we have a lot of different options that is not included in the basic package. For example, we do all the genetic testing. If you're interested, we could do it at the same day, at the same time. I don't think a lot of these checkup centers do these extensive tests for genetics, things like that. Genetic testing. We also do, this is all options, but we also do epigenetic testing for biological age. This helps, it's a blood test, but it helps to see how your DNA is modified by epigenetic changes that is due to stress. And that gives you like a biological age, which is compared to your chronological age. For example, I did this EpiClock test. It's an epigenetic test. I'm 61 years old, but it turns out I was 60, so that's fine. One of my colleagues also did the test. He's 70, but his biological age was 75, and he was surprised. What should I do? And we checked him up very closely, and we found that he had a risk for renal disease. The regular blood test didn't show that, but these are things that can be seen in epigenetic changes in your blood. So he started taking medication to lower his cholesterol levels and things like that, so that will change the biological age that can be tested with this epigenetic testing. And you can see for yourself that your biological age goes down after a while. So we have all these different options for patients depending on their needs. The package that I showed you, this is the basic package. And depending on your genetic background or your family history, we can offer additional tests. It does cost extra, but we have several options that we can do. We even have a program where we can make your own iPS cells if you're interested. It's expensive, but we can make your own iPS cells and have them frozen stocked for future use. these are several options that can be offered aside from this, but
What is that, Professor? What is the IPS?
no, so we can make iPS cells from blood. So we take blood from the customer and we can make iPS, not us, but we have a contract with this company that makes iPS cells for you. And we can have the iPS cells frozen, stocked for future use. It's like insurance. It's very expensive, but I mean it's an
Is
option.
it for stem cell or for making what in the for the blood from the blood?
To make iPS cells from blood, yeah.
Oh, IPS is what? Sorry.
Oh, sorry. The induced pluripotent stem cells, these are stem cells that can be used for anything.
Okay. From our own blood. So it's like
Yes, from your
autologous
own.
stem cell.
Yes.
Oh, so do you prefer to use the stem cell from the blood or from the fat or from the bone?
So we use mesenchymal stem cells from fat. Now, this is already something that's done every day. The stem cell I was talking to you about from the blood, that these are induced pluripotent stem cells, iPSC cells, and these cannot be used for treating someone right now. There are studies going on to treat retinal disease, other diseases as well. We're doing research on the eye. So this is something just for the future. But if a patient is interested, we can offer that service as well.
Oh, okay. So do you do stem cell from autologous or from also from the other
From donors,
factory stem cell?
we do both.
Okay. And from the stem cell that is not from our body, usually you make it from the baby stem cell and then regenerate it.
For when we use stem cells from donors, we use cells that are taken from tissue, not babies.
Oh, tissue. Okay.
Now, the one service that we're doing now is, I'll talk about it in my next talk, but cells from corneas to treat corneal disease.
Oh, wow. Okay.
So
Actually,
so compared to other centers, what I wanted to say is that our center here in Haneda offers the clinic, the checkup as well, but we also do therapy. So it's like it's a one-stop institution where you can do the initial screening to therapy. And if you need extensive therapy, we refer you to Aichi, our main hospital in Aichi. For
Dr.
the
Aryo,
different people.
yeah, thank you.
Ya,
Dr. Aryo, Dr. Dia, maybe or other teman yang lain mungkin ada pertanyaan?
ya, Dr. Sonia and Prof. Shimura. I got it, the point of standard diagnosis for the cancer. I think, Fuji Hospital have a holistic diagnostic from the epigenetic and then imaging and then like laboratory. And Prof. Shimura said have in a Fujita Hospital after the diagnostic release and Fujita Hospital can provide the medication like a stem cell. Stem cell mungkin Dr. Sonia di Indonesia udah mulai banyak ya. The question is for the cancer, is it possible to get the stem cell treatment or not?
For
Because
cancer, yeah.
Yeah, Prof. Because in the medicine, have a perception for one of the type from the stem cell, like from the embryo, is to be contradiction from the stem cell, especially for the cancer case. How about it?
So since we are a university, we are not doing therapy that doesn't have much scientific background. I mean, if there's no evidence, we don't do much of that. I know that there are clinics that offer stem cell therapy for cancer, but so far there's not much evidence showing that it's useful. So we aren't doing things that are really not backed by science. So For cancer therapy, we are not doing stem cell therapy at the moment.
But for the stem cell therapy, usually what therapy is being done in Japan for what kind of cases and diagnose, Professor Shimura?
Yeah, so for some, so what we offer is stem cell therapy for fertilization technology.
Hmm.
This is to have babies, right? We also
Oh, use
do,
stem cell.
yeah, we use stem cells for that.
Oke.
So
And what?
what happens is that when women start to get old, the ovary, from what this is what I hear from my specialist, but the ovary becomes stiff, and when we use stem cells injected into the ovary, the tissue becomes softer, and that allows more eggs to be released to allow impregnation. So this is something that we are doing more now. It's we have a lot of patients from China actually, but yeah.
Okay,
We
what else besides
also
fertility?
do surgery, stem cell therapy for knee joint disease.
Okay.
Osteoarthritis is a very common indication. But again, osteoarthritis, it works for initial stages. It doesn't work for, end stage disease where the patient can't walk at all and if the bone is destroyed, the stem cell therapy won't work. So the whole point is that we have doctors that are very experienced so they can advise patients whether they have indications for stem cell therapy or not. A lot of clinics around the world, they will offer cell therapy for patients even if they don't have an indication for it, You understand what I'm trying to say? Stem
Okay.
therapy, timing of therapy is the most important thing in regenerative medicine. It doesn't work for everybody. It's not a magic cure.
Yes.
Yeah. So determining whether the patient is eligible for stem cell therapy is probably based all on experience of the doctor, and that's what we offer.
Doctor, I have a question.
Sure.
Yes. I'm not a doctor and not also someone who work in medical. Okay, so I just a patient.
Sure.
Based on my experience, it's like this. In my opinion, okay, a general medical checkup is really important because you can find like what is wrong with your body. Okay.
Mhm.
But usually based on my experience, after the general medical checkup, there is no what we call it, yeah, like okay, you found the problem, and then the right doctor like telling you, okay, you have this, that, but we also suspicious that maybe you have this, that. You must go to this doctor, for example, dietetics doctor, this doctor, that doctor, something like that. That kind of service that we don't have. That rarely to get here. I mean, depend on the doctor or depend on the hospital that you met. Some doctor, they want to take time and telling us, oh, okay, this is the result and you must go this, that. They find like what is the real problem actually who cause so many problems inside your body, for example. So since you have this, I heard from your presentation that your hospital also you have the robotic medical checkup and everything, something like that. So what I want to know is like this package and the service that you provide, right? The general checkup, and after that, then you will your hospital also will provide like service like to telling us like what is the real problem there, something that either your hospital can do or your hospital cannot do, or we should go to this doctor, another doctor, do this, that test, something like that. That kind of service that I really want to know.
Yeah, so we
Because
do, obviously we don't just do the checkup and then send you the results and say good luck. No, we take care of it depends on how severe the problem is. I mean, some of these problems can be left for the next checkup the next year. But if you need something that needs treatment, then we refer you to doctors that can treat that disease. It doesn't necessarily mean here in Haneda because we have limited resources, things that we can
Yeah.
do, we do. And if not, we refer patients to either the Fujita Hospital in Aichi, or we can also refer patients to other hospitals within Tokyo if there is a good doctor for that disease.
Okay. And if like that, also you selling the package, right? So the most important is like how much is the package, and also is it also the hospital provide the service, which is, since we are foreigner, so for example, the price that we pay, including the hotel or something, or service that straight away from hospital, from airport, we
Mhm.
arrive at hospital or something like that. That kind of,
Yeah,
Yeah.
so
Later,
understand what I mean.
yeah, we will
maybe that's
send you, the logistics of it all, the pricing, transportation, hotels. We can give you that later on. Is that okay?
Yeah.
yeah.
Okay.
Nanti
I'm just talking
I
about the
can
medical part.
I can
Uh,
send you about that one, Monique.
yeah. Okay.
Yeah,
Okay.
I can
The,
send you. But yeah, because I've been to the medical checkup. So after they get the result, and then they will send me which doctor should we do the appointment, so we can go by Zoom to the specialized, or we can go there to do some more medical checkup and some more checkup for that particular. Misalnya kalau kita waktu itu aku ada masalah di tulang sama di uterus sama di mata. Nah, kemudian aku di refer lagi ke dokter spesialisnya, Mon, yang apa? Yang sesuai. Kemudian aku ketemu lagi pas kebetulan waktu itu ke Jepang, tapi kalau enggak mungkin bisa lewat Zoom. Nah, habis itu nanti diteliti lagi, terus nanti dikerucutin. Oh, jadi ini sebabnya apa nih? Terus terapinya bisa apa aja? Nanti kita bisa pilih gitu, Mon. Terus mengenai paket-paketnya nanti aku akan mengirimkan kepada Ibu Monica.
okay. So, but the medical checkup, what I understand is like your hospital provide very advanced medical checkup, right?
It's a 2-day course, yeah. So
Okay, because based on my experience, it takes 3 doctors. Finally, the 4th doctor realized what happened to me, and then I just had my heart ablation, which is because of arrhythmia tachycardia 9.1%. So we have 3D PVC. Okay, but before that, actually, my problem is something related with the womb, gynecolo, something like that. But because I will have surgery, and then we found out that I have this, I have that, I have this, I have that. And I was thinking like, okay, what is the general checkup that I've been doing every year? Why they couldn't find the problem? I mean, while near surgery, and then they must cancel my surgery because suddenly, oh, I have arrhythmia, something like that. And the other doctor find out something like so. What we expect from a medical checkup is like,
so the general medical checkup is extensive, but it's not deep. For example, if you have arrhythmia and if it's not present when we're doing the checkup, we won't be able to find it. So
yes,
it's a different
what I mean
level.
is like this, though. If one hospital at least can telling us from the result of the general checkup, this, that, and we have this doctor, that doctor for this problem, this, that, then okay, because moving from one hospital to another hospital, one doctor to another doctor, if your hospital sending us to another hospital, at least your doctor can collaborate or can communicate with the doctor before, because as a patient, sometimes we don't even remember what the doctor tell us to tell another doctor, the new doctor, something like that. So that's what we mean. I mean, your hospital have also brands or another hospital that if you cannot do the procedure, you can send us to another hospital and then you can collaborate or communicate, right?
Of course,
Yeah,
yes.
we have the same electrical medical records.
Okay,
So,
doctor.
obviously.
Okay, doctor. Thank you.
Jadi nanti diurusin semua, Mon, don't worry. Nanti diurusin detail, kalau misalnya itu kemana gitu. Jadi very detail dan persis udah diurusin di follow up ya, Profesor
Okay.
Shimura.
Okay.
Thank you, Monique, for the question. And also, Professor Shimura, about the longevity, you said that you have a specialized department for the longevity. May I know usually what do you do there? Like, is there any special blood check or DNA check? And also, is there any treatment or for the longevity for make us live longer, like Japanese people can live until 100? plus years old.
So no, yeah, the epigenetic testing is a separate option, but what we do at that longevity center, what they do is they, for example, they check your diet, they check the way you eat, the speed with which you eat, things like that. That it's mostly like a checking your lifestyle, and to give advice to change your lifestyle to achieve a more longer lifespan. It's not something that you change in one day or anything. It's very general. It's diet, sleeping. We do tests for the gut microbiota to see what how the microbes in your guts are doing. Then we offer advice on the type of supplements or foods that you should take to change that environment, things like that.
About mental health also, or
Mental health, not no, we're not doing mental health yet, but
okay, more about the lifestyle and eating and the supplements, yeah, that
yeah,
you should take
supplements, yeah,
every day.
diet, food, sleeping, yeah,
Okay, sleep,
exercise as well, yeah.
exercise. Oh, so you tell what exercise is the best for your body to live longer.
We can give advice, yeah, our department, the region and the rehabilitation center, we have a
Okay.
doctor that can offer advice, yes.
Is there any sleep test also? Sleep apnea test or any other sleep
We
test?
do have, for those who do the 2-day course, we have a simple sleep apnea test. We can also do tests for arrhythmia as well. The Holter EKGs, we have that as well. It's an option, but it can be done.
Oh, you need to sleep in the clinic.
No, we sleep in a hotel. We're connected to a hotel upstairs. So
Okay. Oh, so you just put the device and
yeah,
then
we
you
put the
can.
device on for sleep apnea, or the devices, the Holter EKGs for arrhythmia, things like that, if the patient wishes to
Okay.
do that. This is not for everybody, but it's an option. Yeah.
Okay. Thank you, Professor. So please move on to another slide and then we can have another question and
Sure.
answer. Thank you,
And
Professor.
so my second slide is on our eye center. Again, we have two ophthalmologists, myself. I'm a corneal specialist. And we have another doctor, Dr. Ozal, who specializes in the cornea. The eyeball is very small, but it's divided into different components. And as you can see, the eye, this is a model of the eye. Whoops, one sec. Let me change this. Okay. So the eye is divided into the anterior part and the posterior part. The anterior part is the cornea and the lens, and the posterior part is the retina. And any disease of these components can cause blindness. And visual abnormalities, there are different types. For example, cataracts or corneal disease causes the clouding of the entire visual field, whereas retinal diseases such as age-related macular degeneration, these causes the warping of your image or loss of visual fields, as in this picture of the Tokyo Tower. Other diseases, this is a genetic disease, retinitis pigmentosa. This is pretty common in Japan. It's the third leading reason for blindness in Japan right now, but these are patients who have symptoms such as loss of visual fields or tunneling of the vision, meaning the vision field is getting very narrower and narrower. So these are symptoms, again, that in advanced disease, they go blind. And what we are trying to do is detect these diseases in the initial stages and try to treat them if it's possible. This is like, for example, partial defective visual fields. This can be caused by glaucoma. And if this glaucoma progresses, the visual field sort of gets narrower and narrower until at the very end, you might go blind. And so for the various treatments that we offer, I do the corneal transplantation, corneal regenerative medicine using cultivated cells, cell therapy. We do cataract surgery as well. And Dr. Ozawa does the retinal surgery at the back of the eye. And this is my subspecialty. For example, this is a condition called bullous keratopathy. This can be caused by genetic disease, or it can be caused by multiple surgeries of the eye. This type of disease requires a corneal transplant. We do offer corneal transplants using donor corneas from the US. We import the corneas and do surgery here in Haneda. This can be arranged within a month, usually about 2 or 3 weeks. And this is, I think, is a great service because in Japan, as well as in other Asian countries, including Indonesia, I think that you have a lack of donor tissue. So patients who need transplants, they have to wait years to get a corneal transplant. But we can offer that within a few weeks because we can import corneas from the States. And as you mentioned before, I've done more than 1,000 cases of corneal transplants. So I can safely say I'm one of the more experienced surgeons in Japan. And I also teach transplants in the American Academy of Ophthalmology meeting. This is the biggest clinical ophthalmology meeting in the world. It's held in the United States once a year, but I teach transplant techniques in that meeting as well. There are several different ways to transplant corneas. These are all the different techniques. It's a bit complicated, but what it says is that we transplant the different sections of the cornea. For example, we can do a full thickness cornea, or we can just transplant the cells or the endothelial layer, very thin layers of the cornea. So we choose the type of surgery depending on the patient. And we choose the least invasive type of surgery for that patient. And these are all techniques that require a lot of experience. This is a chart showing the pros and cons of each technique. It's very complicated, but I wanted to say what I want to say the most is that, for example, this full thickness transplant can be used to treat any disease, but this replaces the entire cornea. So it's a very invasive technique. It has a lot of complications and there's a lot of rejections associated with. So depending on the disease, we choose these different, more layered type of approach to disease. And we can do any of these, all of these in Haneda. And the latest one, this is the surgical technique using cultivated cells. This is the stem cells from other patients. These are cells that have been cultivated from donor corneas. And from one cornea, the company who makes the cells, they make like about enough cells for about 100 patients. So several times every year, we have access to these cells and we treat patients with this disease called bullous keratopathy. We inject the cells in the patient's eye. The patient faces down for 3 hours. And in 3 hours, the cells attach. And as you can see, it's just an injection. So the wound is very small. It's about 1 millimeter. So it's a very non-invasive technique that helps these patients to see better after surgery. I also do surgery for ocular surface disease. This is a patient with stem cell deficiency. For these patients, we can offer cultivated stem cell sheet transplants, as in this case. In this case, we have both cells from the patient himself. This is cells made from the healthy eye. People have 2 eyes. So if only one eye is afflicted, we take cells from the healthy eye and make a sheet to transplant to the diseased eye. We're doing more and more of these. I'm sure you have this in Indonesia as well, but this is to treat myopia. The ICL lens, this is a very good lens. It can be transplanted from a 3 millimeter wound, and it helps cure patients who have very high myopia. That's nearsightedness. This can only be done for patients between 20 years old and maybe up to 50. Because the lens is inserted here, patients will get cataracts after 60 years old usually, so the lens has to be removed after that. So for younger patients, this is a good device to treat myopia. Cataract surgery as well. We offer the latest high-end intraocular lenses for cataract surgery. As I said before, I've done more than 10,000 cases, maybe 15,000 cases now. I do a lot of surgery. But in Haneda, we choose patients. So, and we only offer the high-end lenses. So This is also an option. I'm sure a lot of surgeons do cataract surgery in Indonesia as well, but what we offer, usually the newest types of lens is offered in the US and Japan first, and then a few years later, it's available in other Asian countries. So for the latest type of models, we can offer them probably a few years earlier than Indonesia. Other types of disease, the intraocular lens for presbyopia, this is the lens multifocal lenses. I'm sure you have this in Indonesia as well, but we can do that depending on the state of the eye. So from here on, this is about retinal diseases. There's very different conditions for retinal disease. This is called age-related macular degeneration. It's a disease of the retina at the back of the eye. The retina functions like a film in a camera. It's required for useful vision. And if the retina is diseased completely, then you go blind. For example, this is some of the symptoms of age-related macular degeneration. You can see here this red blob here. This is hemorrhage. This is retinal bleeding that can cause decreased vision, or as you can see here, thwarted images, distorted images, such as this. This is an advanced case. If it's too advanced, it's very difficult to treat. So what we do is we check for patient for retinal disease and then offer therapy before it gets any worse. So our basic checkup that I talked about in my previous talk also includes a pretty detailed examination of the eye as well as the retina. So we can also detect initial stages of retinal disease as well. This is probably not something offered by other medical centers. And as you can see, AMD, macular disease, is very common worldwide. It's the #1 cause of blindness in the US, and it's getting higher and higher in East Asian countries, as well as probably in other Asian countries as well. These are some of the symptoms. They can be very, in this case, there's a lot of bleeding here. This is atrophic. This is dry AMD. It's not necessarily just the bleeding, but the retina becomes more and more dysfunctional. As you can see here, the color is not good. So it's very difficult to differentiate these different stages of disease, and even more difficult to choose the right therapy. But Dr. Ozawa here at Haneda, she's very experienced with this, and we can offer the best therapy for that patient. We have all these different devices to check for the diagnostic equipment. We have this more high-end type of devices that are available today. These are just examples of what these diseases look like. This is an OCT device. This is a scanning of the retina. You can see a very detailed image of what the disease looks like. And we do angiography. This is using to image the vessels, and you can also see bleeding or leakage from the vessels as well. And so using these different devices, we can plan a strategic method to treat these patients with either medication, surgery, or antibiotic therapy. And this anti-VEGF therapy, VEGF is a growth factor that causes these abnormal vessels to come out. And this is a biological agent that we inject into the eye, and this will stop the progression of disease. For example, this patient with AMD, you can see that the edema, the space here, this is due to leakage of vessels, and you can see some bleeding. But by using these injection of anti-VEGF therapy, this lesion becomes less and less prominent, and you can recover some useful vision if you start therapy early enough. These are the different types of therapy that have been available so far. Every year, there's a new type of antibody treatment that is coming out. I'm sure Indonesia has some of these as well. but Japan and the US, I think some of these agents come out earlier than other countries. And so we offer surgery for patients that are not responsive to antibiotic therapy. For example, this patient, it's scarring. So we do surgery to remove the scars as well. This, for example, this patient here has skewing of the visual image, then this can be caused by these membranes in the retina. If we remove this, some of this can be treated. And starting next year, we're also planning to start the first iPSC, a stem cell derived treatment for retinal disease. It's a bit complicated slide, but this is for patients with diseases of the retinal pigment epithelium. This is the back part of the retina. Once these cells are damaged, the patient usually goes blind. And a lot of these patients are genetic. So we do genetic screening first. And if the patients are eligible for stem cell therapy, we offer that as well. Transplantation, as you can see here, we have all the devices necessary, but we inject the cells behind the retina to put the new cells behind the retina that allows them to attach and then prevent the advancement of disease. This is the type of therapy that we do. This is the sheet made from iPSC cells, and they're injected within the retina. And this attaches, and it stops the prevention of disease. So we're planning to start this next year. We need to genetic test to make sure that the patient is eligible for the disease. Not all patients can be treated with stem cells, but for those that can, we have to make sure that they have the right genetic background to receive this therapy. And so we do genetic panel testing prior to surgery. The purpose of testing is to check if the patient is eligible for this for the therapy, the stem cell therapy. And we also offer genetic counseling for patients with genetic disease, and all this is approved by the government. It's evidence-based therapy. And we have experts that we meet once in a month and to check the genetic mutations that we found from the patient and then give advice to the patient as to the prognosis of the disease or whether they are eligible for the stem cell therapy or even genetic therapy that has become available. Well, this is too complex. I'll skip this. And we also do genetic testing for myopia. These are patients that get very high myopia, so we may be able to offer advice or treatments to prevent the advancement of myopia. And for patients who unfortunately lose a lot of their vision, we can also give advice on low vision care. This is like vision care for patients with very poor vision. All these different devices that can be used to help patients who are partially blind. This can help patients to walk outside on the street, even if they have very low vision. And this also takes a lot of training, but this can also be done. And I don't think these are, this low vision care is available in other countries yet. The United States and Japan we only started to do this extensively. So I think this can be a service that can be offered for patients with low vision. So this is the last slide summary, all the different diseases of the eye. We have, including myself, we have subspecialists in both the cornea and the retina, so we can give advice to most patients that come with problems with the eye. And that's my last slide.
Thank you so much, Professor Shimura. You said that the macular degeneration is like quite a lot and quite common, like an age-related disease. So
Yes.
the prevention is to take supplements of the lutein, and then also the next step is it the injection?
If you have disease, yeah, lutein is good. It's a supplement to prevent disease. There's evidence that shows that. But with patients that have started to get the disease, yeah, we can, if they have abnormal vessels, then the injection is the next step. Yeah.
Oh, and after that, for the worst one is the transplantation, retinal transplantation or stem cell.
stem cells transplantation for the retinal pigment epithelium. Yes, theoretically, it's still in the developmental stages, but hopefully next year we can start this for patients that are getting advanced disease. Yeah. It doesn't
So,
cure the disease, it just stops the prevention.
oh, it's not getting it back to the better.
No, it's just to stop the progression. That's why it's important to find these patients before it's too late.
Oh, so you cannot prevent only by lutein supplement?
Well, lutein supplementation is good to prevent the disease. And most patients with that, you can prevent the disease. It's just the patients that develop the disease. If the disease advances to late stages, this is the same as cancer. If it's too advanced, we can't treat it, no matter what.
Oh, so it's the injection of the the injection is
Yeah.
is a must for the light macular degeneration, or you can wait.
So we need to offer the injection at the right stage of disease.
Oh,
If it's too late, if there's bleeding, then you need surgery. If it's too late, there's bleeding and the retina is damaged, there's nothing more you can do.
oh, so the injection can stop to progress to the worst.
Yes, exactly. And the stem cell therapy will probably help reduce the number of injections that are required.
Oh, so can we do the stem cell only without the injection?
We start with the injection, and if it doesn't work, then we can do the stem cell therapy.
Oh, is there any side effect for the injection or the stem cell therapy for the eye?
So there are side effects because if you repeat injection, sometimes you get an infection. This is something that can't be avoided. It's not very high, very low risk, and then for cell injection, we still don't know. There aren't too many patients that have done the technique yet. So this is something that we have to see.
For all of the stem cell, do we need any cancer screening checkup first before doing the
No.
stem cell therapy?
No.
Oh, it's okay.
Yes.
Okay. Also for the knee, for the rejuvenation, we don't need.
No. Sonia-san, 聞いた? 그렇죠, 大丈夫だよね. はい. 소니아さんだけかな? そうですね.
And
Whoop. I think you're. Kita.
hello, sorry, I think I'm lagging.
Yeah,
Okay,
you were
so
offline for a while.
sorry, yeah. So we don't need, the cancer screening.
No, I don't need cancer screening.
Okay. Is there any other question from Dr. Aryo, Dr. Ria, or teman-teman sekalian? If not, maybe I'm going to ask Dr. Lia, because she has experience medical checkup in Haneda Fujita Clinic before. Yeah.
Hello,
Thank you so much, Professor
everyone.
Shimura. Thank you so much, Professor Shimura, for the presentation. Yeah, and on Dr. Lia, can you please share your experience about your medical checkup in Fujita Clinic, Fujita Haneda Hospital, Research Hospital in Tokyo?
Hello, everyone. Can you hear me?
Yes.
Yes. Yeah, I just quickly, so as not to take up too much of everyone's time, and just to add to everything that has been mentioned, for me, what stood out with the executive checkup at the Haneda Clinic as compared to what we have had done all the years in countries like Singapore and the Philippines is the thoroughness. We did not have to make any of our own decisions or rely on our own options in any part of the medical checkup because the whole package is very thorough, really looking into every nook and corner of the body through all the perspectives of all the advanced imaging and devices and machines that are available um, in Japan and in Haneda Clinic, as compared to recent checkup in Singapore, where they offer you many packages, and a lot of them leave it up to you to decide which 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 certain additional options you would like, which organs you would like to check, which I find is difficult, especially if you do not have any medical background, or if you are not really guided because you probably are well in general and are asymptomatic. But like Dr. Shimura very importantly reminded us, the most important thing is to screen thoroughly so that we can catch the earliest signs of any disease, especially cancer, before it progresses. And most of these are asymptomatic. So I think this is the most important difference that I found. And secondly, of course, I was very pleased with the hospitality, which is very something that I enjoyed also, along with the very thorough executive checkup that we experienced. Thank you.
Mungkin Pak George ada yang mau tanya, Pak George atau teman-teman yang lain? Ada Dokter Farma juga. Mungkin Dokter Aryo ada mau nanya apa mengenai mata, operasi mata? Katanya operasi katarak transplant itu susah. Jadi di Jepang ini bisa mereka mengorder 2 sampai 3 minggu, kemudian ditransplant, kornea transplant. Pak George, maybe do you wanna ask something, Pak George? Oh, maybe Pak George masih mute. Sorry, tekan speakernya. Masih mute ya, because Pak George have been going around the world. So you maybe want to ask some question about medical in Tokyo. Pak George belum ketekan speakernya. Speakernya masih audionya masih dicoret. Kembali. Before that, mungkin Profesor Shimura about the age myopia or presbyopia, the plus and minus and cylinder for old people like 40 and above. Is it also can be cured with what kind of technique, Miss Professor Shimura?
For myopia, we use the ICL. It's like a contact lens that we put inside the eye.
Okay. For the other presbyopia or
Well,
cylinder?
so the presbyopia, it's not correcting the presbyopia itself, but it's treating the lens. It's like cataract surgery, but we put in a multifocal lens that allows the patients to see from far to relatively close. So it's not,
cylinder is also the same.
yeah, cylinder as well, yeah.
Is there any side effect, or how old is the maximum age that we can put that lens?
Oh, for cataract surgery, there's no limit. There's no age limit.
Okay. For the lens also unlimited ya?
Yeah, no age limit, no age limit.
Oke. Ya, Pak George mungkin bisa tanya Pak George. Tadi udah
Bisa
kebuka nih
kedengar
suaranya.
ya?
Iya,
Udah bisa
dengar.
kedengar?
Yes.
Okay. Can you let me know what kind of stem cell that you inject? This is the first question. The second question is how many milliliter you inject to the eyes? Thank you.
For stem cell therapy?
Yeah, for stem cell for the eyes.
Yes. So for the eyes, what we have, for example, one sec. Can you see the slides? Oh, not yet. No, wait.
Not yet, Doc. Not yet, Professor. Yes.
Okay.
Coming. Yes.
The most common one we do is this one here. This is a product called Visnova. This is about not much, just 300 microliters of cell suspension in the eye. It's very few.
0.3 milliliter, right?
Yeah.
Okay. And the stem cell is come from umbilical cord or from
Oh,
where?
These are from the cornea. From donor.
From the cornea.
Yes.
Oh,
from
this
the
is special.
donors.
From donor cornea. So this is cells from donor corneas.
I see. Okay, okay. So it means you are ready for that donor, or we need to find that donor?
No, the company that makes this cell product, they make all the cells and they provide us with the cells. So we don't have to look for donors. The patient can come and then we just inject.
Okay. Is it expensive or not?
It's very expensive.
Wow. So I need to ask Dr. Sonia how much is it?
Yeah,
Yeah,
it's,
please let me know later. Oh, or do you wanna say the price or
I can say
later?
I need my
Okay,
calculator. It's very expensive. For example, you want in US dollars?
Yes,
Yes.
please.
2万1食が200万だからいくらだそれ。One sec. And I can't find my
So
calculator.
this is for the corneal disease, yeah, Professor?
This is for the corneal disease, yes.
All of the corneal disease, you can use the stem cell for the
No.
regenerative.
It depends on the disease. For example, ちょっと計算してください。200万がいくらかと2000万がいくらか。So for example, for ocular surface disease, this is also using stem cells from this is usually using patients' own stem cells, the corneal stem cells. But this can also be done. 150円。
This procedure take how long or how many days or hour,
Oh,
Professor?
this injection is like 10 minutes. And then the patient has to face down for 3 hours.
But if the other procedure that is the stem cell from our own cornea, it needs to be extracted and then needs to be
Exactly.
make first like for maybe few hours or weeks or
No, it takes about 2 months.
2 months. Okay.
So you need 2 surgeries.
Okay. But it depends on the disease, yeah. It should be
It
can be
depends on the
used.
disease. It depends
Okay.
on the disease. So when we so for example, so for corneal transplants, we offer it for 14,000 US dollars for
Okay.
transplants. And the
Okay.
stem cell therapy is 10 times that.
Oh,
So it's very
okay.
expensive.
Okay. Is it
140,000.
can be a cure or
It can be a cure. For some patients, it will last their lifespan, but rarely you get immunological rejections.
okay, but you can also because the corneal transplant from the donor is cheaper than the stem cell. Is it
Yeah.
the same effect?
It's basically the same effect, but the transplants have a slightly higher risk of a
Rejection.
rejection. Yeah, just slightly. So transplantation is fine. There's no problem with the transplant as well. It's just that the stem cell therapy is more advanced. It's smaller wound. But essentially for the patient, if I don't know if it's worth 10 times the price, you know.
Yes.
But I've had patients who said, I don't care how much it costs, I want the latest one. So in that case, we do the stem cell.
Okay.
Okay, one more question.
Sure.
Beside coronal, what kind of disease that you can inject stem cell in your hospital?
So besides the cornea, right now, the most common stem cell therapy we're doing now is for the knees, for osteoarthritis, yeah, of the knees, of the hip joints. Other joints, we do mesenchymal stem cell injections for that. as well as for the ovary, like I said before, for
Oh yeah, for fertilization, Pak George.
fertilization, yes.
Okay. So how many milliliters that you inject to the knee?
For the knees, I don't know the milliliters, but they do inject about 100,000 cells.
Okay.
No,
100
sorry.
million.
100
100
million.
million cell maybe.
Yeah,
Huh?
100 million cells, yeah.
Okay.
100 to
And
200
then
million cells, yeah.
for each, right? For both knee or for each knee?
Usually for each knee.
Okay. So we need to repeat it again and in the next few months, or we just need one time?
So one shot, we still don't know how long it will last. But again, if it's the advanced stage disease, then it may not work. We need to choose patients that have inflammation, but not much destruction of the bone. And that's where the expertise of the doctor comes in.
Okay. So it means the stem cell, it come from donor too, or from where?
For the knees right now, we're doing from the patient. So fatty tissue from the stomach.
Autologous.
Autologous fat cells from fatty tissue of the stomach, of the abdomen.
Okay. Is it expensive or not?
It's not as expensive as the one I talked about before. I don't have the price now.
Yeah, in Indonesia, we have a lot of this kind of patient,
Example, you have a lot of patients. It's about $50,000 about.
Oh, okay. If
But you need
15,000,
50.
50, okay. Understand.
And you need to come twice to take the fat tissue, and then the second surgery about 2 months later for the injection.
Understand.
Yeah.
Okay.
And the
Thank
price
you.
includes both. The price includes both.
Okay. Thank you, Professor.
You're welcome.
Oke, mungkin ada lagi yang ingin bertanya? Dr. Lia? Dr. Lia, do you want to ask more question to Professor?
I'm good. No more questions.
Already?
Sorry.
Do you have more question? No? Oh yeah, for the fertility with stem cell, Professor Shimura, how many % is the rate, the successful rate for the stem cell for fertilization, for the stem cell for fertilization for making baby, Professor? Sorry, Professor, your speaker is still off. Sorry, Professor.
Sorry. So for the fertilization, what happens is that we offer the therapy and we check for the maturation of the eggs, and we also check the hormone levels, and we can see that it's having an effect, but we don't know how the percentage of the patients who actually get pregnant because they go back to their own country.
Oh, okay. How long does it take the procedure? How many days we should stay in Tokyo?
So again, for the stem cell therapy, we need 2 procedures, right? To take the fat and then 2 months later. But each procedure is a few days.
Okay. And how long, if we do the medical checkup, that 2 days medical checkup in Fujita, including the MRI, CT scan, PET scan, colonoscopy, endoscopy, blood test, how long will we get the result?
Oh, so the official report takes about 3 weeks.
Okay, okay.
But if we find something, like if we find cancer or something that's suspicious, we contact you right away.
Oh, like how long is
Well, the
the
next
minimum?
day or the same day or the next day.
Oh, you can do that.
Yeah, we can do that. It's so, but no news is good news, you know, if
Oh, okay, okay. So if there is like a cancer, like one day you can already know from all the
yeah, yeah.
MRI and blood
In which
tests.
case we contact very early.
Oh, okay, okay. So if we still stay in Japan, we can go to the Fujita right away, yeah, to do another checkup
Yeah, I mean, if
for
you're in
that.
Japan, yes, we can do that.
Okay. Miss Dr. Lia, mungkin bisa speaker off, please. Sorry. Yeah. Okay. Okay, I think that's all for now. Professor Shimura, thank you so much for all of your clear and explanation for today, which we have a very good explanation about the medical checkup in Fujita clinic and also the big hospital in Nagoya. Yeah, so we can tadi Monique asked, we can refer our top the Fujita top doctor in Nagoya beside in Haneda Clinic, also there's in Nagoya. So we can they can make all the appointment with the doctor in Nagoya, so they can give all the schedule appointment with doctor in Nagoya, possible by Zoom or by going there to Nagoya. Thank you so much, Professor Shimura. So we'll meet you again in the next session. All right, and also thank you for all the corneal transplant and the other eye surgery. The information is very good and it's very advanced in Japan. Yeah.
Thank you.
Thank you so much, Professor Shimura, for
Bye.
today. And thank you, everybody, for joining. Thank you. See you again. Thank you so much. Thank you, Murakami-san and Takahashi-san. Yeah, it's going very good. Maybe not many people can come because of it's weekday and it's still like working day, but please record and please maybe Magna-san can translate. Yeah, so people can see the very informative session of professor. Yeah. Thank you so much, Mr. Murakami-san, Mr. Takahashi-san. Thank you.